behind me is the listed address for North Coast Biologics, and according to the AG, it's the latest company trying to use the pandemic to scam people out of their money.
While people are rightfully worried about their health and well-being, this individual is preying upon those fears.
North Coast Biologics lists itself as an antibody therapy company, and Attorney General Bob Ferguson says its latest venture could result in a lawsuit.
The referral actually came from the Washington State Department of Health.
Ferguson says the company owned by John Stein advertised on Facebook that it had a COVID-19 vaccine and that it made Stein immune. It was being sold for $400. One problem, a COVID-19 vaccine does not exist anywhere.
And so this is essentially nothing more than a scam.
5 days ago, Ferguson sent a cease and desist letter to Stein to stop immediately. If he doesn't, it could mean a penalty of $2,000 per violation.
Every time he communicated about this so-called vaccine, that would be its own independent violation.
Although the AG has not heard from Stein, the company took down its original Facebook post and put this one up instead, saying because of the letter, the vaccine is no longer available. This is not the only scam Ferguson has seen, from empty promises of cures to financial help.
It seems that there's truly a variety of ways that people are trying to take advantage of this moment in time.
That is exactly right. And we see it also with price gouging. We've received about 1,000 complaints of price gouging.
He says now is the time to be vigilant, no matter how good a claim sounds.
Do your due diligence. Don't turn over your personal information. If something seems too good to be true, hey, there's a cure, there's a vaccine, be skeptical.
If you catch wind of any scams or if you hear about any price gouging, the AG's office wants to hear about it. You can report it on their website, atg.wa.gov. In Seattle tonight, Vanessa Mishanya, King 5 News.
Other news tonight, a paraeducator and daycare worker with the Tahoma School District was in court today on accusations of child molestation. Court documents say 23-year-old Brian Nyers groped children at Lake Wilderness Elementary while he was providing child care for essential workers. After today's hearing, deputies then arrested Nyers for another unrelated incident, and he was booked into jail again, this time for investigation of child rape. New tonight, a spokesperson for Governor Jay Inslee says that we could see an extension of his statewide stay-at-home order, possibly even later this week. The order is scheduled to be lifted at the end of the day, May 4th, but yesterday the governor said that parts of it would continue past that date.
Tonight, the Edmonds City Council voted to give cash payments to low-income families and seniors.
It's the really most cost-effective way to address homelessness is to prevent it from the start. Once individuals are experiencing homelessness, it's much harder and more expensive to put people back into housing.
About 4,400 households, or about 25% of families in Edmonds, live below or near the poverty line. The council approved spending $99,000 for assistance over 3 months. It's still deciding which organizations to work with to distribute those funds.
Nearly 1 million unemployment claims are expected to be filed this week in our state alone. 1 million. Last week, the Department of Labor reported more than 605,000 claims were filed. Since March 7th, when COVID-19 job losses began, the state has paid out nearly $496 million in benefits to Washingtonians. And tonight, we are learning nationally, women are losing their jobs at a higher rate than men during this pandemic. To the King 5's Kayla Lafferty asked the experts why it's happening and what it could mean for the future of women in the workforce.
The Department of Labor reports nationwide, as of April, more than 700,000 people have lost their jobs due to the coronavirus pandemic. A study out this month by the Institute for Women's Policy Research shows across the country a higher number of those people, nearly 60%, are women.
Well, women tend to be more vulnerable in the labor market in general.
Dr. Diana Pierce is a professor at the University of Washington and the director of the Center for Women's Welfare. According to data compiled by the center, more women are losing jobs because the industry shut down by the pandemic are heavily worked by women.
And the top 10 jobs include food service, retail workers, that kind of job. And so a lot of those jobs are public-facing jobs. A lot of them are ones that have been very much affected by the pandemic.
She says the impacts for women right now are high, but there may be more problems on the horizon.
We're going to have a lot of families that are, particularly families headed by women, they're going to lose income. lose their jobs. And when they come back, the jobs they get will pay even less.
Pierce says the focus now should turn to providing more secure jobs and wages for women.
As we go into this recession and then try to climb out of it, that we make sure that we're not reinforcing poverty level wages that will not provide enough, so that people are forced to choose between housing and healthcare, and between paying for food and paying for childcare.
Kayla Lafferty, King 5 News.
With so many people out of work, some tenants are calling for a rent strike. But landlords say without rent, they can't pay their mortgages.
One tenant can't pay, we might be able to work something out. If all of my tenants didn't pay, that would cause a huge problem for us in a single month.
Elected leaders from all across the state held a meeting today calling for more federal protections for both renters and landlords in the form of rental assistance. A spokesperson for Governor Inslee's office says that he's in regular discussions with the state legislature about the need.
Our local hospitals and labs are testing thousands of people every day for coronavirus, and that includes testing for antibodies. So we've had our Verify team talk with experts to break down the difference in the types of testing. Here's Jason Puckett.
There are a lot of tests for the coronavirus. The FDA has a list of 50 approved and about 115 more that are being reviewed. And they use a lot of different methods to get a test sample. There are nose swabs, finger pricks, blood samples, and more. So what's the difference with these tests? We brought in Dr. Michael Borowitz, the Executive Deputy Director of Johns Hopkins and the Laboratory Director of Johns Hopkins Hospital.
There's really two fundamentally different kinds of tests that tell you different things.
The first is the molecular test, or what most people think of as a COVID test. Most commonly, they use a nasal swab deep in your sinuses to get a sample. The sample is then tested for the actual virus itself.
Molecular tests, the tests that actually look for the RNA of the virus, are analytically very accurate.
The benefits of this test? According to Dr. Borowitz, it's the only definitive way of knowing if someone currently has the virus and whether they're contagious. The negative, it's a little slower, typically taking about a day for results. The second type of test is the antibody test. It's a quick turnaround test, results in minutes. Instead of testing for the virus itself, these tests look for antibodies your body made fighting the virus and the potential for plasma development used in treating the symptoms of COVID-19. But it has its limitations too.
It doesn't tell you just because a patient has an antibody that he's necessarily immune to the disease. That's what everybody wants to know, but that hasn't been proven.
And it can't tell you whether you're actually over the virus.
You don't know for sure when you have somebody who has antibodies is whether or not they're still infectious. So if they've had the disease and they've developed antibodies, they may or may not still be infectious.
So basically, the molecular COVID tests tell you if you have the virus. The antibody tests tell you if you've had it. And Dr. Borowitz believes as antibody testing continues to develop, there's potential they can do more.
If we ever get to the point where the results of those tests are not only telling you exposure, but also telling you immune status, then they become extremely important, because then at that point, you can start using them for making decisions about how you manage people.
If you've got any other questions for us to look into, send us an email. With your Verify, I'm Jason Puckett.
There is a glimmer of hope tonight in the pursuit of a COVID-19 vaccine. Scientists at Oxford University in the UK say they have been working for decades on a vaccine to stop other coronaviruses. They adjusted for immunity against COVID-19 and tested it on 6 monkeys at the Rocky Mountain Lab in Montana. None of the tested monkeys became sick after exposure.
If you can have a vaccine in the next 6 months, it makes those other measures that many of us are suffering from at the moment, being isolated and not being able to interact, more worthwhile if there's an end in sight. And I think there is.
One manufacturer in Massachusetts told NBC News it is preparing to scale up production of the vaccine. If more trials prove successful, the first batches could be ready in Europe by September.